Historical disease I wanted to talk about was Hansen's disease, which is a kind of a friendlier way of saying leprosy. The story of Hansen's disease, though, in my opinion, is most interesting when we talk about the story of Father Damien in Hawaii. So I lived in Hawaii for 6 years, and I visited this particular place quite a lot. And so it was interesting history to me, having seen it firsthand. So at this point in Hawaiian history, there was increased trade and immigration, and that brought a whole bunch of different diseases. For example, measles darn near killed a third of the indigenous native Hawaiian population, and was one of the contributors to nearly causing the population to go extinct back in the early 1800s when it was being opened up for trade. In 1835, there was the first documented Mycobacterium leprae infection. So Mycobacterium leprae is the etiologic agent of leprosy or Hansen's disease. So by 1866, King Kamehameha V ordered lepers to be quarantined on Molokai. It was such a stigmatized disease, not super deadly. Eventually people died of it, but it usually took 20 years. The problem is it was extremely disfiguring and therefore stigmatizing. So, and again, at this time, so here's Molokai. Here's Molokai, and here's Kalaupapa. So Kalaupapa is the leper colony that they established, and this beautiful little peninsula on the north shore of Molokai. And so they would basically just come from Oahu, which is right here, and then sail over to the north shore of Molokai, and you can see the little dot sticking out right there. That's this right here. And so they would send over the boats. They would just basically not even try to get close if they could. If they could, they would, but I'm sure, it was often stormy. I've been to the beaches quite a lot over there, and it's often really wavy and stormy and not stormy. There's lots of waves and lots of wind action, and so it's really difficult to pull up a boat. So they often would just throw people overboard, and if they could swim, fine. If not, they didn't care. And then and many of these people being brought there were just children taken from their families, and a lot of times the families didn't want them, thinking that they were cursed because they had leprosy, and so therefore it was just easier to get rid of them than face the stigma. So again, so the populations of individuals that were exiled to Kalaupapa just became feral. They formed clans, and if little kids were dropped off there, the poor things were probably just obviously mistreated in many cases. And so you can imagine all kinds of wild stuff that must have happened. So by 1873, Father Damien, a Catholic priest, was assigned or volunteered actually to go to Kalaupapa and to sort of bring religion and order to the population there. So he served as a priest and doctor and basically just an overall leader as the sort of de facto mayor. Eventually, Father Damien contracted leprosy in 1884 and died in 1889, so 6 years after he had arrived. So here's Father Damien at roughly 33 years old, and here's Father Damien 16 years later, right around 49 years old. You wouldn't be able to tell looking at him, but again, he obviously was dressing wounds and so forth, and it wasn't hard to imagine that sort of intimate contact caused this problem. It was such a divisive sort of issue that individuals were so spiteful of the people in Kalaupapa and were upset that Father Damien was making lots of demands to better their lives, that they maligned him in many ways. For example, even accusing him of having sex with these people, having sex with lepers, and that's why he was sick. And so they did, because there were physicians at the time who believed that leprosy was nothing more than an advanced stage of syphilis. So lots of crazy stuff. There's lots more to this story. And if you get a chance, when all this COVID nonsense goes away, there are tours that you can take from Honolulu to Molokai to see this peninsula. There's probably about 12 or so Hansen's patients that still live there. Anyway, so by the 1940s, Dapsone was developed as a drug and was shown to be an effective therapy against leprosy. And it wasn't a cure in and of itself, but it did rapidly clear up the outward physical appearances and did knock the microbial load down significantly. Dapsone is an antibiotic that, or is a drug rather, it's not an antibiotic, but it's a drug that inhibits folic acid synthesis in bacteria, so that they can't make nucleotides and DNA essentially and RNA. So again, the drug was used and was effective, but again, it's always tricky when you use a single drug to fight something, because often the microbes will develop resistance. But I'll get into mycobacterium infections down the road when I talk about TB. So by 1969, they abolished the isolation laws, and so patients were free to leave, but a lot of them didn't know anywhere else to go. Their families had abandoned them, and so they decided, well, I'm just going to stay here. So there was basically a population that endured. So today, this is old. So I say, because I already told you that's about 12 or so patients left. So this is actually old. I should change that right now. There's about 12 that remain. About 1 million cases worldwide of Hansen's disease. And again, they prefer that. Even the individuals that I talked to when I visited Kalapapa were pretty adamant about not referring to it as leprosy, because it has such a biblical stigma associated with it. But millions of people are disfigured by the disease, and here you can see an individual with Hansen's displaying itself typically in the extremities. So this individual's hands have been slowly destroyed by the microbe and the microbe's enzymatic activities. So the microbe is slowly eating the tissue and killing the nerves. And so this individual can't even feel these feet. They're like clubs at this point. This appearance in this individual's face. It's called lepromatous leprosy, where the individual starts to develop a lion-like appearance. So again, the fact that we have treatments, but lots of individuals are still infected and disfigured by it, is pretty frightening. This image shows you some pictures taken from the airplane, and so here you can see from the air you can see. So here it's a sheer rock wall, and that's why they chose this peninsula. Because if you lived here in the community, you're not getting out of here. You're not going topside, because this is I've climbed this mountain. I've free climbed this mountain. There's a narrow little trail, but I've climbed this on one occasion, and it was treacherous, and I almost fell 2,000 feet to my death. So it's not something that you could just casually do. But typically normal people would just fly, and that's what I did. The second time I went was actually flew in, which in its own way can be a little sketchy, because the airplane is really tiny, and you have to land on this tiny little airstrip at the tip of the peninsula, and there's a very narrow margin of error, so the pilot has to be really good. So he swings around from Honolulu and then lands right on this little airstrip right here. But anyway, you can see the main town now from the air, and then obviously the airstrip would be over here. And if you have a chance, read a book like this from Alan Brenner, Molokai. There's also a movie entitled Molokai, which is more of a closer to the actual facts, with Father Damien and actual events from historical record. But this is a historical fiction that follows the life of a fictional character. But they tried to use as much real life story as possible to talk about this woman's life. It's a very sad and touching story, though, so if you get a chance, you might want to look at that one. The regimens for treatment that we use now are multi-drug regimens that last several weeks, so it depends on the particular case. So a full course of 6 blister packs, but each blister pack contains treatments for 4 weeks, and so you can kind of see that these things take a long time. And the reason for that is that the leprosy bacterium is a very slow grower. And so you have to keep the drug dosages high and consistent for a long period of time. Because remember, These are antibiotics that have to work on actively metabolizing microbes. And so if their metabolism is slow, the drug's main mechanism of action will be inhibited. So there are two versions, paucibacillary and multibacillary. Paucibacillary just means that an individual, for whatever reason, has a low level of bacteria in their tissues and blood, whereas multibacillary means the individual is a little bit more susceptible, and therefore the bacteria are able to replicate a little bit better. So here's a paucibacillary adult treatment and a multibacillary adult treatment. And you can see the difference between these regimens. And then obviously over here is child, multi, and paucibacillary. But just as a look, just looking at the paucibacillary adult, for example, this is, so for once a month on day 1, the individual will take 2 capsules of rifampicin. So RIF is an RNA polymerase inhibitor, and then a tablet of dapsone. So these are, good-sized tablets, a tablet of dapsone and 2 rifampicins. So on the first day, you're kind of just front-loading 2 different kinds of drugs. And then once a day for the next month, the individual just stays on a course of dapsone. And then, but you can see that with the multibacillary, it's a little bit more sophisticated, where on the first day, the individual is front-loaded with 6 different capsules. In this particular case, it's RIF, clofazimine, and dapsone. So you're hitting the microbe in three different ways to limit the likelihood of resistance developing. And again, then the maintenance dose of 1 capsule of clofaz and 1 tablet of dapsone. And again, the full course is 12 blister packs, and so it's a long time. These individuals are kept on these drugs for a long time. So now, obviously, you can imagine that if the individual forgets or gets, just decides not to do it anymore because it's a pain, you can imagine how quickly the microbes would develop resistance. At least the ones that haven't been killed, there's a strong selective pressure to develop resistance. And so that typically happens. Most, like strep throat or ear infection, those courses of antibiotics are usually 5 days and then you're done. and so that's much easier to keep and follow through on. Whereas these are far more difficult to follow through on. Another historical disease is good old smallpox. And so I would, and I always have to talk about the story of Edward Jenner. And so here's Edward Jenner administering his smallpox vaccine to James Phipps here. And there's a neat story about that. And that's illustrated in this video. So I do want you to watch this video. It's a really nice sort of cartoony look at the process. And so from that video, I want you to understand the difference between variolation and vaccination. Dig out those 2 terms. Make sure you understand the difference between variolation and vaccination. And so here's an individual with smallpox and what you don't see, you see all the external pox, but what you don't see is this individual's mouth looks just like that. His esophagus and his trachea look just like that. Smallpox is growing everywhere, not just on the external extremities. One of the most important people in microbiology history is Louis Pasteur, and here he is in his lab in the 1800s. So the first thing that Pasteur did of note was worked for the fermentation and beverage industry, working on contamination. And basically what he showed was that contaminated wine, for example, had high populations of, these bacteria. And so he was able to associate spoiled wine. So, for example, a wine that had, high levels of volatile acidity. So, for example, rich in vinegar. He was able to associate that with the presence of certain kinds of bacteria. And sure enough, eventually we've come to realize that those types of bacteria are acetic acid bacteria that produce acetic acid from ethanol. And so he was able to take this basic concept that bacteria can spoil wine and use that to develop the germ theory of disease. So the idea here is that, well, if bacteria can spoil wine, then they should be able to spoil blood too. And so Pasteur created that concept, or let's just say he contributed to that concept of the germ theory of disease. And then obviously once he had the sense that germs can cause disease, then it was a logical step to look at ways to intervene, such as vaccine development. So some of the early vaccines he worked on were for cholera and anthrax, basically just taking the microbes and heat killing them, for example, and then injecting them individuals to elicit an immune response against a dead bacterium, as opposed to an actual infection with a live bacterium. And he also improved the rabies vaccine, just to use different approaches to kill the virus, or kill or weaken the virus. And so he also did procedures where he would dry the virus down, and then figured out how long it took for a dried preparation of virus to be safe to administer, which is kind of scary because it's rabies, the deadliest virus known to humankind. Joseph Lister took the germ theory concept that Pasteur worked on and used that to establish this aseptic technique, essentially. And so in this particular case, it's using a phenol, essentially, which is carbolic acid mist during surgery. And so Lister was pretty keen to the fact that a lot of surgeries and a lot of soldiers that were wounded and should have recovered from their injuries were not recovering because their wounds were becoming infected. And then obviously some of the surgical procedures were questionable, like sawing off somebody's leg with dirty utensils. Did not help either. And so these types of observations led Lister to believe that maybe if we use some antimicrobial compounds in the surgical theater and so forth, we could limit the number of individuals that die. And he indeed did. And so Lister is the namesake of Listerine, for example. So Koch is also one of the heavy hitters of the day, along with Pasteur, and Koch proved cause and effect in microbial infections. And so again, I got this quote from a book entitled Microbe Hunters that was written I think in the early 1920s by a very colorful writer named Paul de Kreef. And so, de Kreef is kind of paraphrasing what he thought Koch might have said, I believe. I don't know if he actually got this from Koch's journals or anything. Doesn't sound like something a rigid intellectual German doctor would say. But anyway, basically what Koch is saying here is, what's the point of me being a doctor when I don't even know what's causing disease and I don't even know how to treat it? What can I do? And so he's basically, it's basically establishing the motive by which Koch starts to seek the answers to his questions. And one of the things that he had done was started looking to science to start answering questions. His wife had bought him a microscope, and he started looking at blood and tissue of dead things under the microscope to see if he could see something. And what he did see in many cases was different types of germs in different kinds of tissues that had clear or pathology. Individuals with anthrax, for example, or tuberculosis have very clear pathologies. And so, but he started associating the presence of different kinds of microbes with those pathologies, and that's where he started postulating his germ theory. And so here is just the pushback, the normal pushback that a lot of innovators get when they first start saying what they're saying. And here they're saying consumption, which was the sort of the ancient term for tuberculosis. Consumption due to a germ, one definitive kind of germ, nonsense. And so obviously there's pushback. Koch is saying, every time I look at a tubercular lung, for example, and I look at the lesions in the lung, I find these little types of microbes in the lesion. So I think they're causing the problem. And then obviously there's pushback. So here's Koch, picture of Koch, and some of the original micrographs of anthrax bacilli in the blood of animals that he noticed that had died of anthrax. And so again, their blood blackens, their skin blackens, and obviously they're dead. So there's some outward appearances that are quick, that are easy to diagnose in that case. And so he plucks some of the blood and takes a look at it under his microscope and sees these, what he calls sticks and threads, which are nothing more than the gram-positive bacilli of Bacillus anthracis. And so this organism typically grows in long chains as well. So it's almost like strings of sausages, links of sausages end to end. And so he comes up with a really neat, simple way to, not super simple, but an ingenious way to establish cause and effect. And so here he decides to take blood from a dead sheep that he has diagnosed as having died from anthrax, and he stabs that into a mouse using baked wooden slivers. So the cool thing here is he's using baked wooden slivers as a way to sterilize his device so that he knows that nothing came from the slivers themselves. It was whatever came from the blood of the sheep. And then, this is Decreef from microbe hunters asking this question: will that beast, that mouse, die of anthrax? So basically, by taking blood from the dead sheep, stabbing it into the mice, and then asking the question, will the mice die? And then if they do die, can he recover the sticks and threads? And that forms the basis of Koch's postulates. So postulate 1 is the microbe must be present in all people or animals with the disease and should be associated with lesions of the disease. And so again, this is Decreef again. It's basically paraphrasing what Koch might have been thinking. It's only when man or beast has tuberculosis that I can find these blue-stained rods. Postulate 2, the microbe must be isolated in pure culture from a human or animal that has the disease. So the key here is fixing a food for them that is near possible a living animal's body. So basically, how are you going to recover the microbe from that wound? That's a huge limitation. If you can't figure out the food they want to eat, then you can't do Koch's postulates. And that's a real-life problem that we have even to this day. So, for example, we have no way of culturing syphilis, the bacterium that causes syphilis, Treponema pallidum, on pure culture media. We still know that Treponema pallidum causes syphilis through other means, but we haven't been able to isolate them in pure form. So that's a really tricky part. Postulate 3, the isolated microbe, when administered to a human or animal, must now cause the disease. So that's great. You take you identify a sick animal or person, you isolate the microbe from that sick individual, you poke that microbe into a healthy test animal, and then to close the loop, you must recover that microbe from the sick, infected individual. And so once you've done that, you can essentially close the loop and establish the cause and effect of that is essential for Koch's postulates.